All right, here we go for today. We are going to be looking at health policy. This is a cartoon from a long time ago, and I think it just speaks so much to where we are today. Ladies and gentlemen, to come up with a uniform health policy, we will now break up into 31 different groups. And that's a challenge for our country. As a democracy, we want everyone to be represented. But different groups have different needs and different things that they want to do. So it's a challenge for us to try to come up with some uniform policy that really addresses the needs of everyone. Here are our learning objectives, going, gone. All right, so we're talking about two things. Public policy. Policy are authoritative decisions made in legislative, executive, or judicial branches that are intended to direct or influence the actions, behaviors, or decisions of others. We are right in the middle of this right now. So you can see how with the COVID virus that we're trying to look at what are the things that we need to be doing to stop the spread of this horrific disease and to minimize illness, death. At the same time, how do we keep the economy going? So you can see that there are warring factions here of we need everyone to stay home. That's the only way to stop the spread of this virus and minimize the impact. Okay, but if everybody stays at home, then the economy fails. And what kind of world will we be returning to? So what we're going through right now is a perfect example of policy and how it's difficult to achieve multiple objectives simultaneously. So in particular, though, we're looking at health policy. So they can be principles. Sometimes they're not laws, they're concepts. We want universal access to health care for everyone in the United States. Okay? The Affordable Care Act attempted to do that. However, the dismantling of that act has undermined the ability to get to universal coverage. So, but in general with health policy, we're talking about the distribution of resources, services that impact the health of the population. So the COVID virus could not be a better case in point. In this country, we've talked about this multiple times in this class, in this country, we have not invested as much of our resources and finances to prevention and public health as we have in the treatment of disease. This has affected how we were able to combat this virus. So we've gone through these of different public health policies throughout the years, reforms in medical education, Medicare and Medicaid, and trying to protect our most vulnerable populations, family planning. It can even be corporate with antitrust laws, how we license physicians, who licenses physicians, and of course you all know this now that it is the states. But also sanitation. And so what are those standards? And something as simple as banning smoking or big sodas, that kind of thing. So there's a whole variety of different things that we try to achieve. So policies can be used as regulatory. And that's where we call on the government to prescribe to control a certain behavior of a particular target group. And if you don't do it, something bad is going to happen to you. If you do not wear that seatbelt, we are going to give you a ticket and a fine. If you gather in groups larger than 10 people in the park without proper social distancing, we can give you a misdemeanor and we can give you a fine. So policy is how we allocate resources as well. So as we said, we do not allocate as many resources to public health initiatives as we do to treatment. So when COVID first was becoming an increasing problem, the idea is that local health departments, once a case was identified, then we're going to do this tracking, okay, contact tracking and tracing, and see everybody who tested positive, who were all the people you came in contact with, and then we're going to follow up with them. How are you doing? Did you get exposed to it? Are you feeling sick? Are you well? Um, and the challenge, though, if you do not have the funds to hire the people to do this tracing, how are you going to do it? All right. And so initially, when we had 15 people in the whole country, yeah, you can kind of figure that out. But now here we are with hundreds of thousands of cases later. And is that possible? Do we have the resources to do that? And obviously that answer is no. So it can be allocative, but can also be distributed. So who's going to get the money? We see this right now with COVID we have these national stockpiles of health equipment, and who's going to get it? Who's going to decide who gets it? So the federal government, for the most part, decided, well, we're going to give it to the states, and the states are going to decide. So we have unique challenges in our country because we do have the federal government, but then we do have state governments. We have local governments. We have county governments. And so all of these different people we rely upon to do different things in different instances. But even something as simple as construction of facilities. Where are we going to build these COVID hospitals? Who's going to get them? Should they be hospitals for regular care? Should they be COVID hospitals? And so all that's going on is a perfect example of policy, how the money is spent, where the money goes, and what they decide to do. And so it could also be redistributed. So once again, we're concerned because so many people have lost their jobs. The economy is crashing. We want to get money to the people. So the federal government is giving money to the people. All right. Now, you know where I'm coming from in this class. Where did this money come from? Did it come from the money tree? Okay, there are no money trees. So it all comes from taxes. And so we're going to take money from some people and give it to other people who we feel are in need. So that's an example of redistribution. So in general, though, a problem with health policy in the United States is that it's very fragmented. We fix little pieces here and there. Unlike Taiwan, which totally scrapped their system and rebuilt it. We kind of tinker around the edges of changing this and that. And so we do have these, we are different in that we have this federal government and then the state governments as well. And there's a huge impact on whoever the president is, in addition to the people in Congress at the time. So we have President Obama, who really wanted a universal health care system, used his leadership to get that moved forward with Obamacare, the Affordable Care Act. Then we have President Trump. Republicans don't like the Affordable Care Act. They want to repeal it. And so he has tried to chip away at the pieces that he's able to make the whole thing as a house of cards fall in on itself. So we'll be looking at the Affordable Care Act next week. And then policy intervention begins with identifying what markets fail or do not function well. Okay, we're in the middle of market failure, that is for sure. So they're trying to prop up the economy with all the various ways that we know. They're trying to prop up the healthcare delivery system. We're trying to use federal resources to get the ventilators, to get the masks, the PPEs, the gowns, etc. And so the healthcare, the hospital system as we've known it, That's a very lean and mean system. It uh, operates in as efficient manner as possible, but that means that it was lean. If you were a hospital administrator, that would be a number one, lean. We don't want these stockpiles of things. We don't want hoarding going on. And so we want just-in-time supplies. However, in a situation like this, we can see we did not have the backup, redundancy, to have the surge capacity to serve the patient load that we have now. So the government spending fills the private sector gap. As we said, hospitals would be a perfect example. Hospitals could operate fine as they were, but not in a crisis like we have now. But that can also be in the public health sector too, that we need to put more funds into that. The communicable disease that we normally control requires a certain amount of funding, but then you get a pandemic and it needs additional funding. All right, so we have huge additional resources going into public health as well. So as I said, some people, there's this battle. Who does it better? Who is the private sector or the government? And boy, we see a tug of war going on about this right now. And so hospitals are saying, oh, there's certain things we do really good. However, we don't have the backup redundancy that we need. That's the federal government. They should be giving us this stuff. The federal government saying, well, that's a state government function. That's not a federal government function. All right, so you see the blame games going all around here in circles. And so because we are such a fragmented system that is not a universal system for everyone, that it's hard to coordinate getting all these different pieces and parts to work together toward a common goal. With something like Hurricane Katrina in the Gulf Coast, when it's one isolated area like that, it works a little bit better that we can marshal all the resources to come together to work on that problem. But I'll tell you, even with Katrina, a problem was the resources that they needed, those were in California. All right, there were forest fires at that time, and those were predicted to get worse. So the government resources were all the way in California. Katrina hits, we needed in New Orleans. So they had to truck all that stuff from California or airlift it into New Orleans. And so that created a several-day delay as well, because it kind of caught people off guard there. But in general, there are people that think that the centralized government is the most efficient way to deal with everything. Other people are like, no, the private sector is much more efficient, and that is the better way to go. So how does policy get formed? It doesn't come just from the government in the United States, okay? And so for policy, we have the legislative, which would be Congress groups, the executive branch, which is the White House presidency, but then there are a lot of private interest groups involved as well, who are coming together and deciding what should we do. All right, so we're going to look at these private interest groups in a minute. Some examples of private interest groups and healthcare is the American Medical Association, retired people, the Hospital Association, the American Healthcare Association, which is more of the outpatient side, pharma, and then business who pays for this stuff. So they're the biggest purchasers of health insurance through the workplace. So all these people are coming together, and they have different perspectives and want different things. They all have lobby groups. Those lobbyists are there. Not the lobbyists don't only influence legislation, they write it. Okay, they actually write the legislation for Congress people. Here's a new bill. Here's some language that you might want to use in it. So they're very, very integral group of, and they're all tied together. I've got to say, I don't want to divulge too much here, but I just found my nephew just got a new job, and he was going to be working as an attorney for a large corporation that does mining in a state out west that has a lot of mining of precious minerals. And he worked for the governor for a good while. And that was his job as the governor, to look at resources for the state. The governor, after he stepped down from being governor, he's now on the board of the mining company. So he gets paid to be on the board of the mining company after he's been the governor. He liked my nephew who worked for him, and he suggested this large company hire my nephew at a very high salary to work on the legal aspects of mining in this state that they want to state. Okay, this is how big business and government work together. People that were once your Congress people, presidents, governors, go to work for private interests. So as we said, states have their own roles, and we've talked about these. They do the licensure, training, they create risk pools for insurance, which are done by state, not by the federal government. They decide how to structure their Medicaid programs, for example, and a lot of regulatory things. So we have both the feds in some ways, we've got the states going in some ways. So let's look at how policy is formed. I think that, for example, let's take the legal limit, the legal blood alcohol limit. Okay, that's a good example. There is an organization called MAD, Mothers Against Drunk Drivers. How did that start? Had a mom. Daughter was killed by a drunk driver. Mom's upset. Thinks that our drinking limits are too lax. And so she went on the news a lot. My daughter was killed by a drunk driver. We should not have drunk drivers. We need to lower the blood alcohol content level that is allowable in driving. So that's the policy design. Goes on the news. We want to get every state in the United States to change its blood alcohol content limit to 0.08. Gets a lot of support, forms MAD chapters all over the United States, goes to each legislature. You need to pass this legislation. And then it took a while, but they did. Every state in the United States agreed with this 0.08 blood alcohol content level. So that's gives you an example of how policy is formed. It can be legal limits of driving. It can be click it or ticket, wear a seatbelt, helmets on motorcycles. There's all kinds of things that have followed this process of issue raising all the way to legislation. But let's make clear of one thing. There's policy, this is kind of what we want to happen. But then there are actual laws. And so one thing I want you to understand, that the Congress of the United States has 3 powers to legalize policy. They have the power to make all laws. The president may work with them, may suggest things, may propose things. The president does not pass laws. Now, the president can veto a law that the Congress passes, but Congress can then go and with a supermajority overrule the president. Okay, so we tend to think of the president as being a king and deciding all this stuff. That's not true. Your Congress people are very, very important in this. They also have the power to tax. So they are the ones who decide what taxes are going to go. And then they also allocate. So they spend. So think of just how important these Congress people are. We tend to focus on the president. Not saying the president isn't important, but your Congress people, your senators, and the House of Representatives are very important as well. So as far as we were talking about access to care, this is a fundamental question that we have to answer. Is health care a benefit or a right? Does every citizen have the right to the same level of care or just a minimal level of care? Is everybody going to get a Ford Fiesta or is everybody going to get a Lexus? Does everybody get the Ford Fiesta, but then if you have the extra money to buy extra coverage or can pay for, you get the Lexus? All right, so these are decisions that we've seen every country in the world has to make. So we've talked about policies a lot in relation to the way that we've allocated money to different groups and that we want to protect within our society. I want to make this point because this is probably something that you're not quite aware of. And since we are in a rural area, there is a recognition that it is more difficult for rural areas to have hospitals than urban areas because there is not a large enough population to support some of the specialized services. And so they did set aside some pools of money to give the rural areas extra funding so that to support the services that cannot be supported by the size of the population. All right. So, and that's under what we call OBRA, the Omnibus Budget Reconciliation Act. Just some ideas of some other things that OBRA does include. So because we are in a rural area, I just want you to realize that there are some special treatments that we get as a result of this. And just to kind of finish up here, this is something that we also is a policy area that there's been more emphasis in with the Institute of Medicine of dealing with this quality area. And so in quality, once again, we talk some about this. Safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. All right, so effectiveness and efficiency, two different things. Equity is different than equality. Equality means everybody gets the same thing. Equity means everyone gets a fair share. All right, so a little bit different. So with healthcare reform, we've talked about this, that prior to the Affordable Care Act, we were the only nation, industrialized nation in the world that failed to assure universal access to basic health care. The Affordable Care Act strove to correct this, and in the next unit, we'll be looking at that. Niece playing with the PowerPoint a little too much. All right, so just one final point here in this area, that part of what the Department of Health and Human Services did launch was Stay Healthy USA, and trying to eliminate disparities in care. And so through that, we do this from CDC, the Centers for Disease Control and Prevention, which has certainly been at the forefront of the COVID crisis, CMS, FDA, and the NIH. Kind of an interesting group. So as I speak today, the nation, the state, is trying to decide, when are we going to let people out of our houses? And so who's going to decide that? So we're going to involve all these different people. You see these people up on the stage with the president if you watch any of his press conferences. But who should decide this? Is it the CDC? Is it the epidemiologists? Is it the medical doctors? Is it the corporations? Is it the president? Is it the Congress? All right, so who shall decide? And so there's a challenge in trying to get all these groups to come together to do something, a simple policy, such as open the doors after April 30th. All right. So I think this gives you a little better idea of what's happening, how policy is made, who makes it, and what some of the dynamics are involved.